The following video should help you with your understanding for this week's quiz.
The intrinsic conduction system consists of specialized cardiac cells that establish the heart rate. Pacemaker cells of the SA node spontaneously generate action potentials that spread through the rest of the conduction system and to all cardiac contractile cells. The result is a coordinated contraction of the heart muscle, with first the atria and then the ventricles contracting. As you observed in the experiment, contractile cells do the work of the heart by contracting, but they need pacemaker cells to tell them when to do it. The pacemaker cells function like an officer giving orders to soldiers, telling them to move. Let's now look at how those orders are communicated. During a normal heartbeat, action potentials originate in the pacemaker cells of the SA node. The impulse spreads across the atria, both via the internodal pathway and through gap junctions between contractile cells. At the AV node, where cells are small and have few gap junctions, conduction of the impulse is slowed as atrial contraction proceeds. The electrical impulse leaves the AV node via the AV bundle and rapidly propagates through the bundle branches. Rapid conduction continues throughout the Purkinje fibers, depolarizing the ventricles. Ventricular contraction follows depolarization. The contraction ends as the ventricles repolarize and relax. The SA node is the pacemaker of the heart because it spontaneously fires action potentials at a rate faster than any other component of the conduction system. If the SA node slows down or fails, the pacemaker cells of the AV node take over to set the heart rate, but this results in a much slower heart rate. The overall electrical activity of the heart is detectable by electrodes placed on the skin. The resulting electrocardiogram, or ECG, records a composite view of all the action potentials occurring in the heart during a given time. The P wave results from atrial depolarization. The QRS complex is generated by ventricular depolarization, and the T wave results from ventricular repolarization. Repolarization of the atria normally coincides with the QRS complex and is not visible. These waveforms of the ECG precede the corresponding contraction or relaxation of the atria and ventricles. Depolarization of conduction system components can be determined from the ECG. When the SA node functions as the pacemaker, it depolarizes right before the P wave. Conduction through the intrinsic conduction system can be determined from the PR interval, the time from the beginning of atrial depolarization to the start of ventricular depolarization. Alterations in the heart rhythm, changes in the QRS complex, or an abnormal PR interval may indicate problems with the conduction system.
Okay, so please make sure for the first part of this week's quiz information that you know the P wave is for atrial depolarization, the QRS complex is ventricular depolarization, and the T wave is ventricular repolarization. Then you also have some additional terms at the top before we get into the cardiac physiology. You have tachycardia, which is a heart rate above 100 beats a minute. That's fine when you're exercising, but if you're sitting in your chair and and your heart rate ramps up above 100 beats per minute, then we know that, yeah, something not right is going on. Bradycardia is a heart rate that's lower than 60 beats a minute. And sure, we try real hard to drop our resting heart rate to down into the 50s if we're athletes or we are trying to lower our heart rate because we're running or something like that. So it's fine to have a low heart rate. But if you're just sitting around and it's always low, then you're not going to be able to pump enough blood to get circulation up to the various parts of your body. So sometimes bradycardia less than 60 beats per minute can be bad. And then the last one, fibrillation, is when you have rapid and irregular heart contraction and you're not going to get a normal rhythm on an ECG. It's going to be all squiggly and all over the place because your heart is firing from a lot of different places and not coordinated through the SA node and the AV node and the structures shown in the intrinsic conduction system. So with fibrillation, then we have to electrically shock the heart with a defibrillator to get all of the cells to coordinate at the same time, and then to stop, allow the heart muscle to repolarize, and then hopefully the SA node will kick back in again. So the remaining videos that I'm going to show you are going to deal with the cardiac cycle, which are the events that are listed on the rest of the packet for this week, or the paper for this week. Know that where it says early diastole and mid to late diastole on your packet, they are exactly the same as ventricular filling. I just have divided the ventricular filling up in two different sections, and just to make it stepwise a little bit easier to see what's happening in the cardiac cycle. So we'll go to let me get back out of this. Sorry, and go to, not this one. Oh dear. Oh, I have to go back in again. Cardiac cycle. Nope, not that one. All right. Okay, here we go.
The cardiac cycle is the sequence of events that propels blood through the heart during one complete heartbeat. Your heart beats in a continuous cycle, represented here as a clock. The cycle alternates between periods of contraction, or systole, and relaxation, or diastole, of the atria and ventricles. The timing is coordinated by the intrinsic conduction system of the heart. The sinoatrial, or SA node, initiates depolarization and systole of the atria, while the ventricles are in diastole. This is followed by depolarization of the ventricles and ventricular systole, while the atria are in diastole. Finally, between heartbeats, there is a period when the atria and ventricles are both in diastole. Contraction and relaxation of the heart chambers create pressure differences that drive blood through the heart. Blood flows from areas of high pressure to areas of low pressure. Contraction increases the pressure in a chamber, whereas relaxation lowers it. Changes in pressure within the chambers also cause the heart valves to open and close. These valves ensure that blood flows in only one direction through the heart. They prevent the backflow of blood into chambers that have recently emptied. As you'll discover, the cardiac cycle is divided into 4 phases on the basis of ventricular activity and the opening and closing of valves. These phases are called ventricular filling, isovolumetric contraction, ventricular ejection, and isovolumetric relaxation. Let's take a closer look at the timing of the events during the cardiac cycle. Representing the cardiac cycle as a clock reminds us that the events of the cycle continuously repeat. However, we will need to unwind the clock and lay it out horizontally to relate the major events of the cardiac cycle to one another. Now we can see the unwound clock depicting one cardiac cycle or heartbeat. Notice the 4 phases of the cardiac cycle. Next, we see the pattern of alternating periods of systole and diastole of the atrium and ventricle. But now we will examine the timing of other changes that occur during the cardiac cycle. The electrocardiogram, or ECG, records the electrical activity of the heart. Electrical activity shown in the ECG precedes contraction and relaxation of the atria and ventricles. As the heart contracts and relaxes, changes in pressure occur within the chambers. These graphs allow us to see the pressure changes in the atria, ventricles, and aorta. By graphing the volume of blood in the ventricle, we can see when the ventricle fills with blood and the volume increases, and when blood is pumped out of the ventricle and the volume decreases. The valves of the heart open and close, which ensures that blood can only flow in one direction through the heart. The sounds of the heartbeat are caused by the closing of the AV valves and semilunar valves. For simplicity, these graphs display changes in valve position and pressure associated with the left side of the heart only. But keep in mind, similar patterns would also be occurring simultaneously on the right side of the heart. As you noticed with the red blood cell roundup, the cardiac cycle is conveniently divided into 4 phases based on the position of the heart valves and ventricular activity. As a reminder, these phases are called ventricular filling, isovolumetric contraction, ventricular ejection, and isovolumetric relaxation. We will explore each of these phases in more depth, starting with the next animation. Because the cardiac cycle is a continuous process, we need to pick a starting point. We will start with ventricular filling, during which both the atria and the ventricles are in diastole. During this phase, blood from the pulmonary and systemic circuits flows passively into each atrium through the open atrioventricular valves and then into the corresponding ventricles. During this process, the semilunar valves are closed. Atrial systole finishes ventricular filling. Now let's examine the major events of ventricular filling graphically, focusing on the left side of the heart. While both the atria and the ventricles are in diastole, the ECG recording initially shows a flat line. During passive filling of the left ventricles, the volume of blood in the ventricle increases. The increase in ventricular volume slightly increases the pressure in the left ventricle. However, ventricular pressure is still much lower than aortic pressure, so the aortic valve remains closed. During a resting heart rate, more than 80% of ventricular filling occurs prior to atrial systole. Depolarization of the atria is recorded as the P wave on the ECG and precedes atrial systole. Contraction of the atria while the ventricles remain in diastole completes ventricular filling. At the end of atrial contraction, the volume of blood in the ventricles is called the end diastolic volume, or EDV. Pressure in the ventricle slightly increases with the surge of blood from the contracting atrium. However, aortic pressure is still much higher than ventricular pressure, so the aortic valve remains closed. The second phase of the cardiac cycle is isovolumetric contraction. Three main events occur during isovolumetric contraction. First, atrial diastole allows blood to begin returning to the atria from the pulmonary and systemic circuits. Second, while the atria relax, ventricular systole increases pressure in the ventricles. Third, when the increasing ventricular pressure exceeds the atrial pressure, both atrioventricular valves close. However, ventricular pressure is not yet high enough to open the semilunar valves, so they remain closed. All four valves are now closed. Now let's examine the major events of isovolumetric contraction graphically, focusing on the left side of the heart. The QRS complex of the ECG is caused by depolarization of the ventricles. Ventricular depolarization initiates ventricular systole, which starts isovolumetric contraction. Ventricular contraction causes an increase in pressure that closes the mitral valve. Closing of the atrioventricular valves causes the first heart sound. During isovolumetric contraction, the aortic valve remains closed because aortic pressure is still higher than ventricular pressure. Since all of the heart valves are closed, blood cannot enter or leave the ventricle. The volume in the ventricle remains constant at the end diastolic volume, or EDV. That's why this phase is called isovolumetric contraction. With the volume in the left ventricle now constant, continued ventricular contraction causes ventricular pressure to rise rapidly, approaching the value of the decreasing aortic pressure. The third phase of the cardiac cycle is ventricular ejection. As ventricular systole continues, ventricular pressure increases, opening the semilunar valves. This event marks the beginning of ventricular ejection. The atrioventricular valves remain closed, and the atria remain in diastole. The continued contraction of the ventricles pumps blood from the ventricles into the pulmonary and systemic circuits. Now let's examine the major events of ventricular ejection graphically, focusing on the left side of the heart. Ventricular ejection begins when pressure in the left ventricle exceeds diastolic pressure, the minimum aortic pressure, opening the aortic valve. Because pressure is still lower in the atrium than the ventricle, the mitral valve remains closed. As blood is pumped into the aorta, aortic pressure closely matches ventricular pressure. Aortic pressure increases to its maximum value, the systolic pressure, and then begins to decrease. As blood is pumped from the ventricle, ventricular volume decreases. The volume of blood ejected from the left ventricle is the stroke volume. The volume of blood that remains in the ventricle after contraction is the end systolic volume, or ESV. The final phase of the cardiac cycle is isovolumetric relaxation. It begins when the ventricles enter diastole and the semilunar valves close. They close because the pressure in the aorta and pulmonary trunk is now greater than in the ventricles. The tendency for blood to flow back towards areas of lower pressure pushes the semilunar valves shut. Now that both the semilunar valves and the atrioventricular valves are closed, the ventricular volume remains constant as the ventricles relax. That's why this phase is called isovolumetric relaxation. Meanwhile, venous return from the systemic and pulmonary circuits continues to fill the atria with blood. Now let's examine the major events of isovolumetric relaxation graphically, focusing on the left side of the heart. Isovolumetric relaxation begins when the ventricles enter diastole as a result of ventricular repolarization. Therefore, the T wave of the ECG precedes isovolumetric relaxation. Isovolumetric relaxation lowers left ventricular pressure below the aortic pressure, causing the aortic valve to close. Rapid closure of both semilunar valves causes the second heart sound. At this point, both the semilunar valves and the atrioventricular valves are closed. With the ventricles relaxing and all the valves closed, there is a rapid decline in ventricular pressure. The volume in the ventricle remains at the end systolic volume, or ESV. Atrial pressure is slowly increasing due to venous return. When the pressure on the atrial side of the mitral valve exceeds that in the ventricle, the mitral valve opens. Now passive ventricular filling can begin. This starts a new cardiac cycle.
Okay, so hopefully those videos will help you to understand what events are happening in each phase of the cardiac cycle. On the quiz, it will ask you questions about the events, and so you will just supply what's happening during each one of the phase in which the events are happening. So remember the different phases, the names of the different phases, and that's what you'll be tested on. Good luck.